Interesting topic, fluoride. We were talking about that a little bit before the show, and you had mentioned I was talking about the fluoride with the Alcoa and that mess, and how the fluoride got introduced into the American water supply and the American municipalities. But you had mentioned about before that with Germany,
Yes. Um,
the initial use of fluoride.
One of the initial uses of fluoride before dentistry, they had uh, our previous president, George W. His father was an industrialist and had his industry produced fluoride.
You're talking about Prescott.
Yes,
Okay,
Prescott.
gotcha,
Prescott Bush.
gotcha.
Uh, his companies produced fluoride. They didn't know what to do with this. They actually sold it to Germany during World War II to use to sedate the POWs, prisoners of war,
In the concentration camps.
in the concentration camps.
Because one of the side effects, or maybe not even a side effect, one of the intended effects
One of the,
of fluoride is
if you want to look at it as a side effect, you can look at it as a side effect. But if you look at the race riots in the 60s and which cities were fluoridated first,
mhm.
one questions whether it was a side effect
or
or
an
not,
intended effect.
or an intended effect.
But regardless of whether it was intended or a side effect, what it does is it makes folks docile.
Yeah.
It makes them lose their will, and makes them submit.
You hear Americans have turned into sheep,
Right.
and you hear it constantly. And I see it constantly.
Hmm.
No one is willing to actually fight for what they know is right anymore. Very few. And that's with the exception of our soldiers, who I have the highest admiration
Mhm.
for. But as a public, we have become so docile and sheep-like, and will listen to information we know is false, but if it's repeated long enough, we start to believe it.
Mhm.
And if you combine fluoride in all the city water supplies, fluoride in the toothpaste, now we were supposed to get a specific dose, 1 milligram a day, or I think it was 1 milligram a day for teeth.
The only measurement that I'm familiar with is the 1 part per million in
Or
the
1
water.
part per million.
I'm not sure
sorry.
about in
I knew
in
it wasn't a milligram. It was
Right.
1 part per million in your water supply. But what people don't realize is the water supply makes sodas. Same
juices,
juices
on the shelves.
on your shelf. Everything that has water
And the
in
same
it.
water supply is used to irrigate crops.
Right. So your 1 part per million quickly grows to 4, 5, 6 parts per million, which was what they were using to sedate prisoners of war.
And then you have folks that are on prescription Prozac, which is 90% fluoride
Right.
in Prozac. People don't know that 90% component of Prozac is fluoride.
Yeah. Don't get me into psychiatric drugs. I'll tell you.
We'd have to do another show there, Dr. Mike.
That would be a whole different show. What is really interesting is if you look at the number of shootings in schools, for example, by children, what they never bring out anymore, they did at Columbine. They admitted at Columbine that these children were on psychotropic drugs.
Right.
They're not admitting it anymore.
But all the kids are.
All of them are.
Yeah.
Psychotropic drugs, the first thing that you should ask, if I were a defense attorney and I had someone that had been a wonderful father and wonderful provider and wonderful husband, and all of a sudden he kills his family, what psychotropic drugs was he started on because he was feeling tired or depressed?
And there'll always be something.
Usually there is. And this is never publicized. And you wonder why you're depressed or you're tired? Look at your food and water supply. First thing,
Right.
look at what you're taking into your body.
Which, if you ask modern physicians, is pure quackery. they're taught that that's not even part of the equation, that food and nutrition have nothing to do with health.
It's funny. In my practice, I had about 70% of my practice were physicians and their families. And these were the doctors that were progressive, open-minded, hungry for knowledge, and the best in their fields. You can always tell doctors that are really good because they're not threatened by new knowledge. The ones that are threatened are the ones you don't want to be going to anyway. If you go to a doctor and you say, does my diet have anything to do with my health? And he said, no, and they say, no, diet doesn't mean anything. Don't ever go back to that doctor again.
Fire him.
You know, fire the doctor because he's not doing his job, he's not doing his homework, and he's not reading any studies, because there are thousands. So, you know, people should be more aggressive with their physicians as far as demanding proper care.
Mm-hmm.
And if they're not getting it, they should have no trouble, no qualms about firing their physician, as long as we still have that right.